So, as a cognitive behavioral therapist, one of the things I really focus on in therapy are the unhelpful thoughts or belief systems that make it really hard for a patient to really see improvements in their mental health. And today I'm going to share with you 6 dangerous mindsets that a patient or person can have that can really impact their overall sense of psychological well being. Hi, if you don't know me, my name is Dr. Parky. I'm a clinical psychologist licensed in the state of Ontario, and I've been studying and practicing evidence based mental health for the better part of a decade, and I love to share some of that information with you. So, the first mindset that's dangerous for mental health is the if it's not perfect, then it's bad mindset, where a person basically has this all or nothing thinking where if they're not doing something and accomplishing to their most absolute perfection, then they're a total failure. Or if they're not totally worthy and always pursuing their goals, always helping people, then they're, sort of a worthless individual. And although this all or nothing mindset can be quite helpful in certain domains, like for example, one of the reasons why some people are so successful during school and during work time is because they have this sort of really perfectionistic stance on, how good their quality of work has to be before it's acceptable. It also increases vulnerability to other mental health issues and other sort of challenges where they often feel like a failure or feel worthless or feel guilty and ashamed because they're not doing as well as they could be or should be. And as we know, we can do everything right, but still sometimes fail. That's not necessarily an indictment on your character or your strengths, it's just sometimes that's life. And when we place our worthiness or sense of competence on an outcome, then it becomes quite tricky because there are a lot of things in life that we can't control. Like, for example, we can't control what other people do, we can't control what other people want, we can't control other life circumstances. So, in that way, that all or nothing thinking, not giving yourself any self compassion, it can really lead to some more problematic mood and anxiety or other emotional issues down the road. A second mindset that's dangerous for mental health is the I'm special mindset, or there's something special about my problem. So oftentimes when I'm working with patients, like for example, in the context of sleep problems, they'll say something like, oh, have you ever seen problems as bad as mine? I bet there's maybe nothing I can really do, or maybe there's just something biologically broken in my brain that's just going to make it very hard or impossible for therapy to really do anything. And this type of mindset is kind of tricky in a couple different ways because one, it increases and engenders a sense of hopelessness that there's nothing I can do because this thing is just permanent in my life. Like my social anxiety will never recover or my depression will never recover because this is kind of like a unique biological case where, other people won't really understand or really won't be able to help me. Which then leads to number two, which is if I don't believe anything is going to work, why would I try anything new? Why would I listen to what this therapist is saying if I know fundamentally that I'm special and there's nothing I can do about it? And something I'd like to say to these patients is that, well, yeah, you might be right, but how does this thought serve you? Because you're either right and, nothing we can do will really be able to help you, or even if you're wrong, if you believe this thought, then you're not going to be willing to really give this therapy a shot. So would it be worthwhile for us to just, try out something new and see if it has any sort of impact or positive outcomes in your overall well-being? A third mindset that's dangerous for mental health is the why should I mindset. So why should I be the one to change? Other people are really mean. Why should I have to do anything different? It's society or the world's fault for why I'm struggling with all these things. Why should I have to make these changes and take responsibility if it's not my responsibility and it's not my fault? So in a lot of ways, these people are unwilling to change because they feel like it's not really their fault and it's the world that should change or other people that should change. So they kind of put their hands on their and say, I'm not going to do anything because it's not my fault. It's not fair. And in a lot of ways, they're right. The world is unfair. Other people can be really mean. It's not always our fault for why we are in our current position. Like somebody who was born in a low income neighborhood and they struggle with a lot of different violence and trauma and difficulty with their parents in terms of their relationship. In a lot of ways, the reason why they're struggling is because of these external factors. And at the same time, our unwillingness to still look reality in the eye and say, hey, it's unfortunate and unfair how I got into this particular moment. And I'm the one who has to be able to do something to be able to resolve the problems in my reality. And this idea behind willfulness versus willingness, I sometimes like to explore as part of a story in acceptance and commitment therapy, where there are, let's say, two people, Bob and John, who were going to the sports arena and they really wanted to play some golf, but the attendant said, actually, there's no more space for golf, but we do have baseball available. And Bob is like, oh my gosh, I really don't want to be playing baseball. It's not fair. So as the machine is shooting baseballs at him, he puts his hands on his It's like, I don't want to play, and the balls continue to hit him in the face. On the other hand, John was like, well, I really wanted to play some golf. At the same time, this is the reality right now, so I might as well play some ball. And he kept, hitting, and sometimes he'd miss, but sometimes he hit that home run. And, at the end of the day, you can kind of see that how we approach these kind of harder situations with willfulness or willingness can really impact how we experience that day. The fourth mindset that's dangerous for mental health, it's the what's the point mindset. So this person kind of just thinks to themselves, all of this is just a drop in the bucket. What's the point? I've been struggling with depression for 30 years. What's calling a friend gonna do? What's taking a walk gonna do? All of this is just another drop in the bucket, and it's not really gonna solve my problems. So here you can kind of see the unwillingness kind of pop up and rear its ugly head again. The person kind of feels like all of these feel so small in relation to their big problem. So what's the point? And as a result of that thought, they think, well, I'm not going to bother doing that, which kind of keeps them stuck in, whatever trap they've kind of set up for themselves. And again, to validate, maybe they're right. Maybe their problem is really, really big, that all the things that they're doing right now are just small incremental steps to eventually get them to where they want to be. And it can feel like a lot of work, a mountain's worth of work to be able to get there. At the same time, just as a journey of 1,000 miles starts with one steps, these little things can eventually build the momentum needed to get them out of that depression trap or the other thing that are really keeping them stuck in the moment. The fifth mindset is the if I feel something, then it must be true. If I feel like I'm a bad student, it must be true. If I feel like I'm a bad mother or father or parent, then it must be true. If I feel like a failure, I must be a failure. And this idea comes from the cognitive distortion or cognitive bias known as emotional reasoning, where if I feel something, then therefore it must be fact, where our emotions dictate how we think, as well as how we feel, as well as how we behave. And although our emotions are often very valuable information, sometimes they don't actually fit the facts of reality. Just because I feel like I'm a bad parent because my baby is crying doesn't necessarily mean that I'm a bad parent. And following that feeling, it sometimes can lead to a lot of problems, because some emotions like sadness or guilt or shame, they make us want to hide away or stop doing things, when in reality we need to be able to actually check the facts and say, well, I feel sad, but me doing nothing is only going to make me feel more sad. So I need to act opposite to that emotion to be able to engender some change, and how I act can sometimes influence how I feel. And you've probably had similar experiences where you felt maybe kind of sad and isolated, and you really didn't want to go outside or take your dog for a walk, but you decided to do so anyway. And as a result, you might have noticed as you were walking your dog or socializing, you actually started to gain more energy, you feel more happy. And that's a really good example that how we behave can actually influence how we feel rather than the other way around. And the sixth mindset that's dangerous for mental health is the it must be me mindset. The sort of personalizing mindset where anything that bad happens, you kind of assign responsibility and blame towards yourself. If the group project is failing, it must be me who's doing something wrong. If I'm talking to somebody and we're not perfectly vibing, it must be because I'm boring and uninteresting and stupid. So you can kind of see that anything that bad happens, there's almost like you're kind of like glue, and you kind of everything that sticks to you. And although taking accountability and making changes to self-improve can be a really fantastic thing, sometimes it's important to be able to actually, again, view reality for what it is, check the facts, make sure that you're not assigning more blame towards yourself than needed, so that you're not necessarily sort of this black hole of all negativity, because the way that you can think of yourself as a result is that you're not a very good person, you're not a very capable person. So take responsibility where it makes good sense, but don't necessarily personalize everything to your faults. And although I could probably talk at length about all the different things that you could do to manage these different mindsets, maybe I'll leave you with one thing for today, which is to engender a sense of flexibility and willingness when it comes to your thoughts and your behaviors, such that when we think about thoughts are just thoughts. They're just kind of random sort of phenomena that come from our brains, and we don't have to put a lot of salience in them. And one thing that I like to think about is to check on their validity as well as their utility. Is a thought true? And even if it is true, is it helpful? And if it's not helpful, can we allow it to pass on by, because we don't necessarily need to engage with them? So by kind of increasing that sort of flexibility, we feel a little bit more in control and managing of our sort of cognitions and different thoughts. And the other piece is to increase a sense of willingness, where thoughts maybe keep you stuck, make you decide, I don't really want to do that. That doesn't make any sense. To say, you know what, like maybe I'll give it a shot anyway. I mean, what I got to lose? I either stay the same and nothing changes, or, I'm doing something with a small possibility that something different might happen. So, moving your hands away from your from sitting on them and actually leaning into the problem, doing something to see if anything changes. Anyway, thanks for watching as always, and I'll see you in the next one. Bye bye.